All right, so hello and welcome. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. Today's video, we're going to be covering 25 practice multiple choice exam questions with answers in order to help you pass your CNA exam. If you haven't already subscribed to our channel, please do so. And then we have multiple playlists. So whether you need assistance with passing the written test, which is multiple choice questions, or the clinical hands-on test, regardless of which state you're in, we have a playlist on our channel, Florida Training Academy, that will assist you. Let's go ahead and start. Number one, everybody. The nursing assistant knows that the responsibilities of the position do not include A, helping a resident to bathe, B, administering a medication, C, keeping a resident's room tidy, or D, applying an ice pack as ordered. So which of those is not a responsibility of the CNA? And if you said B, administering a medication, you are correct. Nursing assistants do not administer medications. It's not within their scope of practice. Only RNs, registered nurses, or LPNs, licensed practical nurses, and other properly licensed personnel may give medications. Number two, which of the following would be considered an example of battery toward a patient? A, the nursing assistant cleans the resident's glasses. B, the nursing assistant asks for permission before touching the resident to assist them to the bathroom. C, the nursing assistant bathes the resident without her or his permission. Or D, the nursing assistant keeps a resident isolated from others as a form of punishment. So whenever you think about battery, think about the use of your hands. That's going to be my hint. So if you chose C, the nursing assistant bathes the resident without his or her permission as an example of battery, you're absolutely correct. So bathing a resident without his permission is an example of battery, as I just stated. But keeping a resident isolated from others as a form of punishment is an example of involuntary seclusion. So, both are bad, but for this particular question, C would be the best response. Number three, the nursing assistant suspects that a resident in the facility is being abused due to multiple unexplained bruises, refusal to answer most questions, and refusal of ADLs, which stands for Activities of Daily Living. Which of the following actions should the nursing assistant take next? A, notify the next nursing assistant assigned to care for the patient about the bruises. B, report the suspected situation to the nursing assistant's immediate supervisor. C, ask the resident repeatedly to identify an abuser. Or D, wait for more proof in order to identify the abuser. Which of these will provide the most safety or a quick resolution for your resident? So if you chose B, report the suspected situations to the nursing assistant's immediate supervisor, you're correct. Abuse in nursing facilities or even suspicion of abuse should be reported immediately to the nursing assistant supervisor. This requires more intervention than the nursing assistant's scope of practice covers. Waiting or notifying the next CNA only about the bruises may delay getting help for the resident. Number four, which of the following is a key part of care when administering a bath to a resident? A, cleaning the perineal or the genital area of a patient before assisting them to clean their face. B, use cool water when bathing a patient to promote better circulation. C, allowing participation in care to promote a sense of independence. Or D, perform all care for the resident in order to conserve their energy. It's going to be C, allow participation in care to promote a sense of independence. When I'm training CNAs, I remind them often that our job is to keep our residents and our patients independent as possible for as long as possible. And here's the explanation. And now allowing the resident to participate in care will raise their self-esteem and allow autonomy, decision making. It is inappropriate, to clean the perineal area, the dirty area, before the face, or to use cool water rather than comfortably warm water. And whenever you're taking your test or whenever you're providing care, you allow the resident to test the water temperature. So we don't need cool water in order to prevent burns. We can have warm water as long as it's comfortable for that patient. Number five, what is the best way for a nursing assistant to prevent infection? A, frequent hand washing. B, apply an antiseptic hand rub before and after caring for residents. C, wear gloves when touching residents, or D, all of the above. What do you think the best response is? And this one's tricky. The best response is A. Because look, if your hands are dirty and you put on gloves, that means that the gloves are dirty. And the antiseptic hand lotions or ointments, they don't kill every germ. So the best thing to do is to wash your hands to remove those germs, those spores off of them. So frequent hand washing is the best way to prevent infection without a doubt. The other measures are supportive. Number 6, MRSA or MRSA is an example of which of the following? A resistant strain of bacteria that is difficult to treat with antibiotics, or B, a bacterial strain that is easy to treat with antibiotics. C says a mnemonic to remember how to act if there is a fire in the facility, or D, a set of activity guidelines designed to keep residents safe. What does MRSA or MRSA stand for? If you said A, you're correct. It's a resistant strand of bacteria that is difficult to treat with antibiotics. And so MRSA stands for methicillin resistant, methicillin being in the penicillin family, methicillin resistant Staphylococcus aureus, and it's very resistant to most antibiotics. Number 7, a nursing assistant cares for a resident. Which of the following skin care measures are correct? A, the nursing assistant does not begin perineal care until a second staff member is present. B, the nursing assistant notes that an unblanchable red area on the resident's sacrum, I want to repeat that. The nursing assistant notes an unblanchable red area on the resident's sacrum and reports it to the nurse. C, the nursing assistant applies talcum powder beneath the abdominal folds of the resident. Or D, the nursing assistant applies a prescription ointment as ordered. Which is best for your patient and allows you to perform the correct care? It would be B. The nursing assistant notes an unblanchable red area on the resident's sacrum and reports it to the nurse, because this is a wonderful CNA who recognizes that this is a sign of a beginning pressure sore. Here's the explanation. It's the duty of the nursing assistant to report any red pressure spots on the resident to the nurse. The nursing assistant may not apply any prescription ointments. Talcum powder is not recommended. If you look at the news lately, you've seen a couple of the companies who have made talcum powder in the past. They're being sued because it has some cancerous agents. And the last sentence says a second staff member is not needed for perineal care. Number 8, before shaving a resident, the nursing assistant checks for which of the following items in the resident's care plan? A, shaving instructions related to problems or issues clotting. B, history of a heart condition. C, presence of the resident's razor from home. D, any previous refusal of ADLs. So whenever we're shaving someone, we know that that could actually cause, the person to be nicked and the person could bleed. And so I think the best answer for this one is A, but let us proceed. And it is A. You want to find out about the shaving instructions because it may say only use an electric razor, especially if a patient could be on blood thinners or they could be on the aspirin. And here's the explanation. It's necessary to check the shaving instructions in the resident's plan of care to be aware of any problems clotting and the necessity of using an electric razor as opposed to a traditional one. So when in doubt, ask your nurse if it's not in the care plan. Number 9, fecal impaction or severe constipation. Fecal impaction may present with which of the following symptoms? A, dark urine. B, excessive flatulence or gas. C, small watery leakage of stool. Or D, abdominal pain. Ooh, this one is tricky. All right, don't get mad at me. The answer is C, small watery leakage of stool. And so here's the explanation. The watery leakage of stool around the blockage is the most specific sign of a fecal impaction, also known as a bowel obstruction. And if you think about it, abdominal pain can be caused by multiple issues. For this particular question, it was specifically talking about fecal impaction. And the way that you would, even have a clue that your patient's impacted is number one, they haven't had a large bowel movement or a sufficient bowel movement to match the quantity of meals that they've eaten, but you do see water leaking from the, from the rectum area. And so that would be a sign that, hey, there's a blockage there and the stool isn't able to pass. Number 10, dyspnea is a term that refers to difficulty with which of the following? Is it urinating, breathing, defecating, or the act of having a bowel movement, or swallowing? Dyspnea refers to difficulty with which of the following? And it's going to be B, breathing. Whenever you see DYS in front of a term, it means pain or difficulty. So dyspnea is a term that refers to difficulty with breathing. Number 11, which of the following statements is true about Alzheimer's residents? A, an increased appetite is common as Alzheimer's progresses. B, residents can never be reoriented because they will immediately forget it. C, the residents may become confused, but hallucinations are never a part of Alzheimer's. And D, it is important to maintain a routine to avoid confusion and overstimulation. So how do you manage, how do you take care of a resident who has Alzheimer's? And the correct answer is D. It is important to maintain a routine to avoid confusion and overstimulation. And here's the explanation. Maintaining a routine is incredibly important to Alzheimer's patients. Hallucinations and a decrease in appetite are common, and it is important to frequently reorient the patient. So whether they retain the information or not, you just want to try to reorient them as much as possible. I hope you're doing well with this test. We're on number 12. Which of the following is a correct aspect of making an occupied bed? A bed with someone in it. A, place soiled linen on the floor until the bed has been remade with clean sheets. B, lower the bed to the lowest level when the procedure is complete. C, avoid raising the bed rails unless absolutely necessary. D, mitering or making those hospital corners of the new sheet is no longer recommended. So when you're making an occupied bed, which one is the correct response? All right, and we know that we're going to leave that bed in the lowest level whenever the care is complete. So the actual answer is B. Lowering the bed to the lowest level is important for safety. Mitering the corners of sheets is recommended, as is raising side rails. And then never place your dirty or your soiled linens on the floor. All right, we're more than halfway done. We're on number 13. Which of the following is an example of a pulse rate that should be reported to the nurse? A heart rate or a pulse rate of 45, 98, 82, or 64? In order to answer this question, you have to know your normal range for a pulse rate in an adult. The correct answer is A, 45. If someone's heart rate is lower than normal, you want to notify the nurse. And so here's the explanation. Any pulse outside the range of 60 to 100, 60 being the low end, 100 being the high end, should be reported to the nurse immediately for the resident's safety. And then don't forget to document after you notify the nurse and check on your patient. 14, the nursing assistant knows that signs of hypoglycemia. Let's teach you another prefix. So DYS, whenever it was in front of a word, that stood for pain or difficulty. Hypo, HYPO, whenever it's in front of a medical term, that means low. And glycemia refers to the sugar levels within the blood. So I'm going to repeat this question. The nursing assistant knows that signs of hypoglycemia or low blood sugar within the blood include which of the following? A, tachycardia or a fast heart rhythm, which would be hard for a CNA to determine. B, polyuria. Whenever you see poly in front of a word, that prefix, it means more than normal. So when someone has low blood sugar, do they urinate more than normal? C is hot and dry skin, or D is sweating. And this one is tricky because Usually polyuria refers to when someone has hyper or an increased level of glucose, so hyperglycemia. So that's your hint. The answer is not B. If you chose D, sweating, you're correct. All right, sweating as well as confusion and tremors are signs of hypoglycemia. You, of course, want to notify the nurse. If you are allowed to do the glucometer checks, the Accu-checks or the finger sticks, you want to go ahead and get that test done, the bedside test. If the patient is able to speak, they have a gag reflex, they can talk to you. You can give them about 4 ounces of orange juice, and of course, follow that with some food that has protein so we can regulate those sugars. And again, if I didn't say it, make sure you notify your nurse. Number 15, which of the following guidelines regarding residents who are hard of hearing would be considered correct? A, encourage family participation to make sure they understand you. B, speak in a high-pitched voice to enhance understanding. C, write down words rather than speaking. Or D, speak clearly and slowly as you face the resident. So if someone has a hearing condition, I would recommend that you do D, speak clearly and slowly as you face the resident. Some of your patients who are hard of hearing, they read lips. So it's important for you to speak, at a normal pace or at a slower pace. So here's our explanation. Speaking slowly and clearly is the key to helping hard of hearing clients understand what you are saying. Number 16, a resident is ordered to be in the high Fowler's position for each meal. Which of the following descriptions is the most accurate depiction of high Fowler's position? The patient lies on their stomach for 20 minutes prior to eating. That's what A said. It's that high Fowler's. B, the resident's bed is at a 30-degree angle with the patient slightly slumped to the left. That's not safe. Please don't feed your patient that way. C, the resident's bed is at a 60-degree angle with the feet propped up. Or D, the resident's bed is at a 90-degree angle and the patient is positioned upright. So what is the most accurate depiction of the high Fowler's position, which is the position needed whenever you're going to be feeding a resident? The correct answer is D. I know you got that one correct. The resident's bed is at a 90-degree angle and the patient is positioned upright as if you're sitting in a chair. High Fowler's is a description of the patient sitting straight up in the bed, meaning that the bed itself has to be in a 90-degree angle to support them. And if the patient's having a hard time sitting up, you can always put some pillows behind their back. That does help too. 17, what protective equipment should be worn when changing an incontinent patient with C. diff? When someone has incontinence, it could be bowel or it could be fecal incontinence. That means that they're either wet with urine or wet with fecal matter. And so whenever someone has C. diff is a very contagious, we're going to call it a bacteria or a germ that can be easily spread from patient to patient, but it causes diarrhea. All right, so what do you think should be worn to prevent the spread of a highly contagious diarrhea? Should it be A, gloves and a gown, B, a mask and a gown, C, a N95 mask, or D, gloves, gown, and a mask? What is going to be the best option? If you chose A, gloves and a gown, you're correct. The nursing assistant should wear a gown and gloves as the most correct response whenever someone is on contact precautions. Place these patients in private rooms. If private rooms are not available, they can be placed in rooms with others who also have C. diff. Wear gloves and a gown when entering their rooms and during their care. And then for patients who have C. diff, the hand sanitizer is not effective. You have to wash your hands before and after care. Number 18, of the following symptoms, which one is most likely due to an infection in a resident? A, pale skin, B, tinted skin, C, sudden onset confusion, or D, aphasia, or the absence of speech. Yes, whenever the patients have infections, especially urinary tract infections, they can become suddenly confused. So the correct response is C. Infection, especially in older adults, tends to cause sudden onset confusion. Tinted skin may be normal for an older adult, as could pale skin. Aphasia, or the lack of speech, could indicate the onset of a stroke. 19, the nursing assistant knows that the term NPO means A, bed rest only, B, no oral temperatures are to be taken, C, nothing by mouth, or D, liquid diet. What does NPO stand for? All right, so NPO means A, nothing by mouth. NPO is a Latin abbreviation that stands for nothing by mouth. It indicates that the client is not allowed food, fluids, or medications. And so as a CNA, you're not going to be filling up that water pitcher. You're going to make sure it stays empty. You can, remind the patient that he or she should not have anything to eat or drink. And you can also put a sign or something, in their room so that others are aware that this patient should not have any food or fluids by mouth. We usually have a patient NPO because either they have a stomach issue, maybe they're vomiting, or because they're going to be pre-op. They could be about to have surgery, or we're still running tests on them, and we can't give them any food or drinks right now. Number 20, the nursing assistant should tell the nurse if the client with diabetes, A, does not touch their lunch tray, B, reports numbness in their feet sometimes, C, combs their hair without being prompted, or D, decides not to finalize a will. All right, so what do you know about diabetic patients and the medications that the nurse gives to them? Why do we have you checking their blood sugars throughout the day? If you chose A, you want to notify that nurse if the resident does not touch their lunch tray, you're absolutely correct, because usually with breakfast, the nurse is either giving the patient, before breakfast, the nurse is even giving them an oral anti-diabetic agent, or they've given them insulin. And those medications are going to work steadily throughout the day. So if this patient doesn't eat lunch, that means their blood sugar will likely drop. So here's the explanation. Someone with diabetes should always eat regular meals to keep their blood sugar relatively stable. Numbness in the feet is also called neuropathy, and that's a common sign of, a side effect of diabetes. So if someone complains of numbness, they could have already had that, but definitely if someone doesn't eat their lunch tray and they're a diabetic, you want to report that to the nurse so that we don't have a hypoglycemic episode. Number 21, the nursing assistant knows that residents on bed rest must be turned A, every 2 hours, B, every 1 hour, C, every 6 hours, or D, every 8 hours. I know you all are smart enough. You all know this answer. Yes, it's going to be every 2 hours. And that's so that we can maintain the skin integrity. And so I usually like to start off with people, especially if I'm, just getting on shift and it's almost time for breakfast. I'm going to have them on their back in a semi-phallus position. And then whenever the food trays come, we'll sit them up into the high phallus position. And then, allow them to eat their food, allow the food time to digest. And they may remain on their back, but not all the way up for, maybe the next hour, hour and a half. And so pretty much I go from back to side, back to the back for lunch again, and then the next 2 hour period they go back to their side. So that way my patients are always being rotated every 2 hours. Number 22, which of the following pulses will be most commonly used by a nursing assistant when acquiring vital signs? Is it A, popliteal, B, radial, C, brachial, or D, femoral? So let's say that you're trying to take a pulse. Are you going to do A, go behind the person's knee? Are you going to be B? Are you going to do B, go for the wrist? C, femoral artery, that's what we use for babies. That's in the upper aspect of their inner arm. Or D, are you going to raise their gown and go for their inner thigh area? And so let's see what you chose. Yes, B, radial. Okay, the radial pulse is the most easily accessible location to take a pulse. And if, again, you haven't subscribed to our channel, please do so. We try to post new videos weekly, and we would love to have you join our family. Not only do we train CNAs, we train nurses and doctors. We do CNA exam prep. We do CNA trainer for nurses. And then also we have our American Heart Association CPR, BLS, ACLS, and PALS courses. And we also provide the instructor classes. So we'd love to have you join our family. Question 23. The nursing assistant is helping residents to eat in the dining room when suddenly a resident stands from their seat and begins clutching their throat while coughing silently. The nursing assistant performs which of the following actions first? A. Ask the resident if they're choking. B. Call 911. C. Begin CPR immediately. D. Begin the Heimlich maneuver. All right, so they're clutching their throat, but they're coughing. So the answer is not what you think. The answer is A. You want to ask the resident if they're choking. Remember, if they're coughing, there's still some air exchange there. It's important to first assess whether or not the resident is choking. If they're able to answer, air is still moving through the trachea. If they nod yes, but are unable to speak, it's time for you to begin the Heimlich maneuver, or the abdominal thrust. The Heimlich should not be performed on anyone who's able to cough or speak. Instead, you want to encourage them to cough, 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 so that hopefully they can clear their own airway. 24. A client at a facility receives a new roommate. While the roommate is in the bathroom, the client leans towards the nurse and whispers, "Why is she here anyway? Is she sick?" The best response by the nursing assistant is A. I'm not sure. Let me take a look at her chart. B. Why don't you ask her yourself? C. She's here for the same thing as you. D. I'm afraid I can't share that information with you. Now, I know what we want to say, but we have to pass this test. We want to be, as politically correct as possible. So let's see what the correct answer is. D, I'm afraid I can't share that information with you. So HIPAA requires that you keep the resident's health information confidential, period. You would only discuss the patient's health information with those on your care team. And luckily, as a CNA, you can always defer questions to the nurse. But as far as a roommate doesn't need to know about the other patient's, records or illnesses or condition. 25. A client with Alzheimer's wakes up more confused than usual one morning. And I just want to throw that out. That's a distractor. So I'm going to repeat it again, but it's a distractor. A client with Alzheimer's wakes up more confused than usual one morning. The nursing assistant knows that after breakfast, it is important to support normal gastrointestinal function by. So how do you promote normal bowel patterns? By A, recording intake and output. By B, brushing a client's teeth. By C, taking the client to the bathroom. Or by D, assisting the client to call family members. All right, so you're going to do C, okay? It's called bladder retraining. We don't use the word potty training, but if you want someone to have good bowel habits and you don't want them having accidents in the bed, you're going to have to take them to the bathroom more frequently, so at least about every 2 hours. So taking a client to the bathroom will most likely prompt a bowel movement, which supports GI tract health. A confused patient may not remember what the urge means, so take them to the bathroom more frequently, especially if they're, bedbound, you can offer them a bedpan. But if they're ambulatory, meaning they can get up and walk, not only will the movement help to promote GI tract health, but them sitting on a toilet in the upright position, gravity will hopefully help push some of the fecal matter out. And guess what, everybody? We did it. We went through 25 questions in approximately 25 minutes. Don't forget, we have multiple playlists, so you can go back. I'll have a link in the description area so you can watch our other CNA practice questions. We have hundreds of questions. There's no reason for you to fail the CNA test. We want to see you get to the next level, and thank you for watching our video. You have a great day. Bye-bye, everybody.